Have you ever noticed a strange change in your body and thought, it's probably nothing? What if that tiny symptom was actually your body trying to get your attention? The truth is, many serious health conditions don't begin with dramatic pain or obvious warning signs. Instead, they often start with subtle changes that most people ignore every single day. In today's video, we're revealing 10 small symptoms with big meanings that could be worth paying attention to. Some of these may be completely harmless, while others could be your body's way of telling you something needs to be checked. And trust me, you'll want to stay until the end, because the final symptom is one that millions of Americans overlook, even though it can sometimes point to a serious medical condition. Let's get started. Number 1, wheezing or persistent coughing. Most people assume a lingering cough is just allergies, a cold, or the weather. And often that's exactly what it is. But if a cough lasts for several weeks, keeps coming back, or is accompanied by wheezing, it could also be linked to conditions like asthma, chronic lung disease, acid reflux, or in some cases, more serious lung problems. Wheezing happens when your airways become narrowed, making it harder for air to move freely. If you notice this symptom continuing without improvement, especially if you have shortness of breath or chest pain, it's important to have it evaluated by a healthcare professional. Catching certain lung conditions early can make a big difference. Now here's something even more surprising. Number 2, numb toes or tingling feet. Have you ever felt your toes go numb for no obvious reason? Sitting in one position too long can definitely cause temporary numbness. But if it happens frequently or doesn't go away, it may deserve attention. Persistent numbness or tingling can sometimes be associated with nerve problems, poor circulation, vitamin deficiencies, or diabetes. Because nerves and blood vessels play such an important role in keeping your feet healthy, changes in sensation shouldn't always be ignored. Many people brush it off until the problem becomes more noticeable. But number 3, pale or unusually white toenails. Your toenails can reveal more about your health than you might think. Healthy nails are typically smooth and have a light pink color because of the blood flow underneath them. If your toenails suddenly appear very pale, white, or lose their normal color, it could simply be the result of aging or a minor nail injury. However, in some cases, pale nails may be associated with conditions such as anemia, poor circulation, liver disease, or nutritional deficiencies. If the change affects several nails, doesn't improve over time, or comes with symptoms like fatigue, dizziness, or shortness of breath, it's worth discussing with your healthcare provider. Your nails are often one of the first places where your body shows signs that something may be changing internally. Now here's one that many people experience but rarely think twice about. Number 4, gasping or choking during sleep. If someone has ever told you that you suddenly stop breathing, gasp for air, or snore loudly while sleeping, don't ignore it. Although occasional snoring is common, repeated episodes of gasping during sleep may be a sign of obstructive sleep apnea, a condition where the airway repeatedly becomes blocked during the night. Untreated sleep apnea has been linked to daytime fatigue, high blood pressure, heart disease, stroke, and type 2 diabetes. Many people don't even realize they have it because the episodes happen while they're asleep. If you regularly wake up exhausted despite getting enough hours of sleep, or if your partner notices pauses in your breathing, a sleep evaluation may be recommended. Treating sleep apnea can significantly improve both your sleep quality and your overall health. Number 5, purple spots on the skin. Most bruises have an obvious cause. You bump into something and a bruise appears. But if you notice purple spots or bruises that appear without any known injury, or if they happen frequently, your body may be trying to tell you something. These spots can have many possible causes, including fragile blood vessels, certain medications, vitamin deficiencies, blood clotting disorders, or other medical conditions. While many cases are not serious, unexplained bruising should never be ignored, especially if it's accompanied by frequent bleeding, severe fatigue, or other unusual symptoms. A simple medical evaluation can often determine whether there's an underlying cause that needs attention. And if you think these symptoms are surprising, the next ones are even more unexpected. One of them appears right on your face, while another can show up in your legs long before you notice any other health problem. Keep watching because those warning signs are coming up next. Number 6, a red rash across your face. A temporary flush after exercise or being out in the sun is completely normal. But if you notice a red rash that keeps coming back, especially across your cheeks and the bridge of your nose, it shouldn't be ignored. While some facial rashes are caused by harmless skin conditions, like rosacea or irritation. Others may be linked to autoimmune disorders such as lupus. The rash itself doesn't confirm any diagnosis. But if it's accompanied by joint pain, unusual fatigue, fever, or sensitivity to sunlight, it's important to speak with a healthcare professional. Your skin is your body's largest organ, and sometimes it provides the first visible clue that something deeper may be happening. Now let's move to a symptom that many people mistake for simple tiredness. Number 7, swollen legs or ankles. If your socks leave deep marks at the end of the day or your shoes suddenly feel tighter than usual, you may be experiencing fluid buildup, also called edema. Swelling can happen after standing for long periods, during hot weather, or after long flights. But persistent or unexplained swelling may also be associated with heart problems, kidney disease, liver disease, or issues with the veins in your legs. If swelling develops suddenly, affects only one leg, or is accompanied by chest pain or difficulty breathing, seek medical attention immediately, because those symptoms can be serious. Paying attention to changes like these may help identify an underlying problem before it becomes more advanced. Number 8, pain in your jaw without a dental problem. Most people immediately think of cavities or wisdom teeth when their jaw hurts. But jaw pain isn't always caused by dental issues. Sometimes it can be related to stress, teeth grinding, temporomandibular joint disorders, or muscle tension. In other situations, especially if jaw pain occurs along with chest discomfort, nausea, shortness of breath, or pain spreading to the arm, it may be a warning sign of a heart attack, particularly in women. That's why unexplained jaw pain should never be dismissed if it's accompanied by other concerning symptoms. Your body often sends several warning signals at the same time, and recognizing the pattern can be just as important as noticing the symptom itself. We've now covered 8 warning signs, but the final 2 are among the easiest to overlook. One often shows up at night, while the other may seem like nothing more than everyday fatigue. Yet both deserve your attention. Let's finish with the last 2 symptoms that everyone should know. Number 9, bone pain that gets worse at night. We've all had sore muscles after a workout or aches after a long day, but pain that seems to come from deep inside the bone, especially if it regularly becomes worse at night or continues for weeks, without a clear reason, shouldn't be ignored. There are many possible explanations, including overuse injuries, arthritis affecting nearby joints, vitamin D deficiency, infections, or in rare cases, certain bone disorders or cancers. The important thing isn't to panic, it's to pay attention. If the pain is persistent, wakes you from sleep, or is accompanied by swelling, unexplained weight loss, fever, or repeated fractures, it's a good idea to get it checked by a healthcare professional. Persistent pain is your body's way of saying something deserves a closer look. And finally, number 10, extreme fatigue that doesn't improve with rest. Everyone feels tired after a busy week or a late night. But if you're getting enough sleep and still wake up exhausted every day, your body may be trying to tell you something. Ongoing fatigue can have many causes, including poor sleep quality, anemia, thyroid disorders, diabetes, vitamin deficiencies, depression, infections, or heart disease. Because fatigue is so common, many people simply accept it as part of life. But when tiredness begins interfering with work, family, or daily activities, it's worth investigating instead of ignoring. Your energy level is one of the clearest indicators of your overall health, and a noticeable change shouldn't be brushed aside. So what should you take away from today's video? The goal isn't to make you worry every time you notice a small change. Most of these symptoms have harmless explanations and often go away on their own. But when a symptom is persistent, unexplained, keeps getting worse, or appears together with other warning signs, your body may be asking for attention. Listening early can sometimes lead to earlier diagnosis and more effective treatment. That's why paying attention to subtle changes matters. If you found this video helpful, let me know in the comments which symptom surprised you the most, or if you've ever experienced one of these warning signs yourself. Your experience might help someone else recognize a symptom they shouldn't ignore. If you enjoy simple, evidence-based health tips explained in plain English, make sure to subscribe because more videos like this are coming soon. And remember, your body speaks to you every day. The question is, are you listening?